Medical news today: new heart and pediatric guidelines plus major healthcare policy shifts, March 17, 26.
Introduction and top headlines. Opening, good morning, and welcome to your daily medical update for March 17, 2026.
Today, we have groundbreaking updates in heart health, a complete overhaul of how we talk about childhood growth, and major shifts in healthcare policy.
The Big Three.
Heart health: new guidelines from the American College of Cardiology call for lifelong cholesterol management starting in childhood. Pediatrics: the American Academy of Pediatrics, AAP, has officially retired the term failure to thrive in favor of faltering weight.
Public health policy: Finance Minister Nirmala Sitharaman announces a priority push for universal health insurance by 2033. Deep dive: the new war on cholesterol. The story: heart experts have issued a full-court press against cholesterol. Key updates. Childhood screening: blood testing is now recommended to start in childhood and repeat at least every 5 years. Early intervention: adults in their 30s should now be considered for statins if lifestyle changes don't lower elevated risks. Goal: addressing plaque buildup decades earlier to prevent atherosclerotic cardiovascular disease, ASCVD. Pediatric revolution: retiring failure to thrive. The change: the American Academy of Pediatrics has released new criteria for children who aren't growing at the expected rate. Why it matters. The term failure to thrive is now officially faltering weight. Compassionate care: experts noted the old term was pejorative and often felt like it blamed parents. This aligns U.S. guidance with international standards used in Europe. Breakthrough studies and clinical news. Chemo Brain, a Phase 3 trial published in the Journal of the National Comprehensive Cancer Network confirms that exercise during chemotherapy significantly reduces chemo brain and mental fatigue. Vitamin D and long COVID: a new randomized trial shows that while high-dose vitamin D doesn't prevent acute COVID-19, it may reduce the risk of lingering long COVID symptoms by roughly 4% for those following strict regimens. Medical education: the National Medical Commission, NMC, has capped new PG seats at 4 per course for non-government colleges to maintain quality. Policy and healthcare access: India focus. Universal coverage: FM Nirmala Sitharaman stated that health insurance is a government priority, with a goal of covering all citizens by 2033. Rare diseases: Budget 2026 has expanded customs duty exemptions to 7 more rare diseases and 17 life-saving cancer drugs. Char Dam Health: Uttarakhand has launched eSwasthya Dam, using AI and real-time monitoring to track the health of pilgrims on yatra routes. EWS. Passively collected sleep and activity data detected early warning signs of depression relapse weeks before a full episode emerged, results of a longitudinal cohort study showed. Medscape. Sleep is an independent and modifiable risk factor for cardiovascular disease, CVD, prompting a shift towards routine bidirectional screening in clinical practice. Experts concluded the Sleep Congress 2025, 19–21 November, in France. Presentations underscored that measurable disturbances in sleep duration, quality, timing, and regularity have direct pathophysiologic effects that often precede or worsen conditions such as hypertension, atrial fibrillation, AF, heart failure, HF, and coronary artery disease, CAD. Experts have urged clinicians to systematically evaluate sleep in patients with cardiac disease and assess the cardiovascular status of those with sleep disorders. Medscape. Aerobic exercise such as running, swimming, and cycling was associated with improved symptoms of depression and anxiety across age groups, a large, pooled analysis found. In an umbrella review synthesizing prior meta-analyses of randomized clinical trials, researchers reported that supervised, group-based programs provided the greatest relief from depressive symptoms, while shorter, lower-intensity exercise offered the most benefit for anxiety. Medscape. Outro. Summary: from lifelong heart monitoring to a more compassionate approach in pediatrics, today marks a major shift toward proactive, patient-centered care. Call to action: what do you think about childhood cholesterol screening? Let us know in the comments below. Don't forget to like and subscribe for your daily medical brief. Disclaimer:
The information must be verified before use. The creator, publisher, and YouTube will not be liable for any negative consequences.